And with me joining is Dr. Aishwarya. And today we are going to talk about a very interesting yet an intriguing topic, conceiving after miscarriage. Well, most moms face these problems, but when it comes to planning for the second time, there are a lot of misconceptions, there are a lot of thoughts, and is a lot of fear through which a mother or to be mother goes through it. Well, let's break this questions and let get the expert answering these things. So without taking a moment, I would like to ask Dr. Aishwarya to please welcome herself, and we can start addressing this issue.
Thank you for introducing me, Dr. Pooja. Very good afternoon to everyone. It's my pleasure to be a part of BabyChakra. I'm myself to introduce myself. I'm Dr. Aishwarya BR, residing in Karnataka, and I'm working in Bharat Kempana Multi Speciality Hospital in Bidadi, close to Bangalore, as a senior gynecologist and obstetrician. And as well, I am also a part of government hospital as a doctor, as a gynecologist and obstetrician. And I'm very happy to be part of Baby Chakra. And my Instagram page is Aishwarya BR Gowda. So for any obstetric and gynecological updates, anyone can. It's a public account, and anyone can actually feel free to follow and message me on Instagram.
Well, with such a senior doctor, today's topic is going to be lovely, and the insights that you're going to be are very, very useful for all of us. Doctor, I have a first question. Is it very, possible that a woman can conceive after her miscarriage? There are many myths around it. So, how would you answer this question?
Yes, Dr. Pooja. See, most of the patients after a miscarriage, especially the first pregnancy, if they have a miscarriage, they always have a misconception telling that conceiving for the second time is a very big task, or it's a myth that conceiving again after a miscarriage is difficult, or it is impossible. Within Scientifically speaking, within 2 weeks post miscarriage, a woman has the capacity to ovulate.
Okay.
That means that her fertility will come back within 2 weeks after her miscarriage. So it's not that she cannot conceive after a miscarriage, just that it depends on what type of miscarriage she had and
Okay.
other medical conditions related to her miscarriage. If she had any other underlying medical conditions like health issues, hormonal issues, or chromosomal issues, then maybe we'll have to evaluate her for to prevent further miscarriages. For that, it is always better she consults a doctor post a miscarriage or during a miscarriage, so that her follow up for next or planning for her next pregnancy will be more healthier, and it will be more the faster.
Right. And as you said that a to be mother needs to undergo a few tests, but everybody in a way, I would say it in a very different manner, that they are in a hurry to plan for the second pregnancy.
Yes.
So how long does a couple generally have to wait after a miscarriage has happened, and when can they start planning for the second one?
See, ideally, we advise patients to take a break for 6 months,
Okay.
minimum of 6 months, or sometimes because nowadays age factor is most of the people are getting married late, so we have to consider the age factor as well. And most of
Mm-hmm.
them are very anxious to conceive immediately after a miscarriage. They'll be in a
Correct.
hurry to conceive. So at least minimum of 3 months of gap post a miscarriage is better to plan for a next pregnancy. That 3 months of abstinence or 3 months of planning for not to conceive is a better idea, because we have to think in point of patient's health as well. Because
Right.
post miscarriage, there'll be so much of physical and emotional imbalance in the mother, where she
Huh.
has to recover. That recovery period is very important. You need to give time for the body to prepare to conceive again for a healthy pregnancy. So it is always better minimum 3 months or maximum of 6 months of age gap between two miscarriage and planning for another pregnancy.
Right. And when we are talking about physical and emotional imbalance, as you rightly said, a partner's role plays very important in
Yes.
this, and time is one of the factors. But for a mother who is undergoing such an emotional turmoil, how does she, attain that patience in her and make herself understand that it is going to happen, so that whenever she's trying to conceive for the next time, what are the precautionary measures that she can consider while, planning to conceive?
Yes, precautionary. To talk about precautionary measures, there are different types of miscarriages. Like
Right.
for naming few, like we have something like blighted ovum, we have something like missed abortion. For each miscarriages, there are different causes,
Okay.
and the causes might be very minor problems, or it might be major problems. So the best
Okay.
thing a woman has to do after a miscarriage is to consult a doctor, a gynecologist or an obstetrician, so that she will get an advice. So there'll be few basic tests which will be done to know what was the cause for miscarriage.
Okay.
Sometimes there won't be any such causes, but it will just happen. For such patients, only reassurance is most of the thing which is required, and maybe some nutritional alteration, diet planning, weight management, or all exercise. All this will help for next pregnancy. Or if we detect any abnormality in the uh, process of examination, so we can concentrate on that, treat her for that, so that her next pregnancy will be a healthy pregnancy, so that there won't be recurrent miscarriages.
Right. I was coming to this point of, diet and exercise. So when can a mother, start thinking after her, start with these activities after her miscarriage, and how much time she should give in between? Like, she has to get back with her positive health, positive mindset, and then move ahead with life to what she is planning for. So when you follow exercise and diet, after how many weeks can she really start working on these factors?
Coming to diet, I think immediately post miscarriage, because usually we call it as a miscarriage when it happens below 20 weeks of gestation. So,
Okay.
if it is an early pregnancy, like less than 12 weeks, if she's had a miscarriage, I think 15 or 20 days of adequate rest is more than enough for her to get back to normal with her normal diet and normal exercise. Just that before planning for next pregnancy, it is always better she starts herself on few preconceptional nutritional supplements, like basic, one of the most common nutritional supplement we usually advise patients to plan and start 3 months before they start planning a pregnancy is folic acid,
Right.
because most of the first trimester abortions are because of folic acid deficiencies and all that. So this
Right.
is one of the most common medication which we advise them to take.
Right. Okay. And what kind of exercises do they can follow? I mean, hitting the gym is not the correct answer, but a midway which you can help in to, choose the kind of exercise for these moms, it will be helpful.
There is no specific physical activity that, which has proven that it will improve fertility rate. It's
Okay.
just that to keep a person healthy. For example, few people are nowadays totally into yoga. If they can resume back to their yoga practice, or few are into their gym practice, so they can resume back to their normal whatever physical activity they have been into. Or there are women who are not into physical activity at all. For such patients, we'll advise at least half an hour or 1 hour of walking or jogging in a day would help them, because because most common cause nowadays for infertility or miscarriage is PCOD. So PCOD
Right.
is always associated with overweight. So we'll at least ask them weight reduction of at least 2 to 3 kgs will increase their fertility rate, so that the chances of conceiving for the next pregnancy is faster and healthier. So
Right.
weight management will depend on person to person. So it is their choice of method what they want to do it.
Right. Thank you so much. Our mother is very concerned and she is having a question that she has had two miscarriages previously and now she is fearing to conceive again. So,
Okay.
how can we help her in, conceiving? I know we have to run a few tests, but at this point of time, what would be the best way to help her out?
Uh-huh. See, that is what single miscarriage and recurrent miscarriages. There is different way we deal the patients with. If it
Okay.
is a single miscarriage, we usually reassurance and then plan. We ask them to plan after 3 months or 6 months as they whatever convenient the patient is. But when there is recurrent abortion, usually we call it as recurrent abortion when patient has two or more abortions repeatedly, continuously. So if a patient is under the process of recurrent abortion, she should be definitely be evaluated for what is the cause for recurrent abortion. There are various causes like hormonal causes, there might be chromosomal abnormality causes, that are genetic level causes, or it might be because of any nutritional abnormalities, or sometimes even there might be no cause at all. It is
Okay.
actually very difficult to treat patients who have no cause at all. So
Right.
we have to there are few basic investigations which has to be done and examinations which has to be done to know what is the exact cause, so that we can start treating her for the cause. So once we start treating her, for example, if it is because anything related to hormonal imbalance, like for example thyroid abnormality, that is
Right.
also one of the cause for abortions. So we need to start her on thyroid supplements, correct her thyroid levels, so that the next pregnancy there is no chances of repeated abortions that patient will go through.
Right. So in depth, we need to. She needs to understand that it could be
Yes, definitely.
medical, non-medical,
And
and we.
I always advise, there is a myth in these outskirts of society that they need to reach obstetrician only after she is 3 months. They don't
Right.
talk before that. They have a myth. I have no clue what is the concept behind that. I feel that has to be the patients have to come out of that, and they have to meet their doctor, immediate obstetrician, immediately once they confirm their pregnancy, because if any abnormality detected in the early stage of the pregnancy can prevent miscarriages.
Correct. I completely agree with you because most of the women try and hide their pregnancy because it's not to
Yeah.
be told, it's not to be
Yes.
disclosed, and that's
Yes.
the reason. Then the fear of going to a doctor, doctor kya kahenge, what would be the
Yes.
outcome,
Yes.
and with that stress, the bleeding starts, and then they get a lot of worried. So definitely, that's a very valid point that you have stated out over here. Thank you for that. And there is another mother who is very keenly asking that her uterus is not supporting the fetal growth
Okay.
whenever she's conceiving. So
Okay.
she is scared that can this lead to miscarriage? Now, this is a fear, this is a doubt. Now, how can we help her out over here?
Uterus not supporting, the most common cause for uterine abnormality for miscarriage is there are uterine anomalies. We call it as anomalies. That is development anomalies. The women would have born with some abnormality in the shape of the uterus. For example,
Okay.
if the shape, there will be two small uterus attached to it. We call it as bicornuate uterus or unicornuate uterus. So
Okay.
such patients, it is the conceiving, they will conceive, but they will have recurrent abortions. But there are few procedures where we can actually correct the shape of the uterus. Like if there is a septum, we can do septal resection. Now as the science has been advanced very well, there are procedures where we can rectify few problems, not all the problems. And along with that, they need extra support during pregnancy, like medicational
Okay.
support or surgical support, like cervical stitch. All this has
Okay.
to be planned for such patients with good obstetric concern, with good
Dr. Aishwarya?
obstetrician.
Yes.
They have to follow the medical guidelines given, so that everything will go smooth. But any day it is risky, but it will definitely lead to a healthy pregnancy.
Right. So we have broken a lot of myths. We have understood the facts. We have understood the ways to tackle these problems. And we have also understood that we have to reach out to our doctor at the earliest because
Yes,
the best care is in their hands. And also, the early detection helps us to prevent the problem rather than facing the problem.
definitely.
So, Dr. Aishwarya, with this, I would like you to, give a takeaway message for all our audience who have been watching us very keenly on the topic of conceiving after miscarriage.
Yeah. Firstly, I would like to tell all the women out there, there is nothing. You are not at fault, or you are not to be blamed for a miscarriage. It is your body. It is the concept of nature, or sometimes it is the concept of your mechanism that the miscarriage happens. Usually in society, if a miscarriage happens, the most common person who will be blamed is the mother. No, none of
Yes.
it is no one else who will be blamed. But I don't think so. You need to have that guilt that it was your fault to have a miscarriage. It is very common to have a miscarriage. 10 out of 10 women, at least 7 or 8 of them will have miscarriage. Maybe the types of miscarriages are different, or number of miscarriages are different, but that doesn't prove that you cannot conceive again, and you can't have a healthy child in your hand. You can All that has to matter is you have to have lot of positivity in you and have a healthy lifestyle, so that you can conceive. And always consult a doctor to overcome any of your fears, so that you'll get to know where you are going wrong and what type of treatment you need to take, so that you will definitely conceive as soon as possible. And always don't hurry to conceive back to back after a miscarriage. Take time for your mental and physical health to settle down, and then conceive, so that the pregnancy, what happens for the second time, will be healthier.
Absolutely, very truly said. And women talk. When you talk about your problems to another woman whom you find, you can trust her. It could be your sister, it could be your mother, it could be your friend, it could be your any relative or your mother-in-law or your doctor. Just talk about what you feel, and when
Yes.
you open up, you feel relaxed, and that will
Yes.
help you to communicate in a very very good manner. And
Yeah.
all the positivity what you get back helps you to boost up your confidence. This is a minute phase or a minor phase which cannot be neglected, and the problems can be resolved with a proper technique. So, with this, we come to the end of this session. I thank Dr. Aishwarya for joining us live, taking time out from her busy schedule, and helping us for these mom stars to answer the questions where a simple myth can be turned into a harsh fact, but if accepted well, it would lead to a beautiful reality. And Dr. Aishwarya, thank you so much, and salute to the hard work and the kind of work you're doing in Karnataka and in the hospital. I know many women, mothers, may be proud of the way you are helping them out in your city. Thank you so
Thank you
much.
so much. Very nice interacting, and all of your questions were very straightforward, and it was easy. I think it made our audience understand things easier. So any doubt or queries, I think definitely the audience can contact me through Instagram and ask any queries.
Absolutely. Instagram is one of the portals, and BabyChakra app
Hmm.
is also one of the portals where Dr. Aishwarya is available to answer your queries. If you haven't downloaded the app, do so and ask your questions in directing to Dr.
I would
Aishwarya.
also like to thank even Baby Chakra. They are doing a very great job by bringing society and doctors talk very close by. It's not that they can sit at home and analyze few things and understand things through Baby Chakra. So I am very glad to be a part of Baby Chakra, and I am very happy about the what they have been providing to the society. And keep going, and definitely we'll reach to a higher levels.
Thank you so much for appreciating us. Thank you so much for joining us live.
Thank you. Thank you.